Hi, I'm Dr. David Verebelyi, the medical director here at the Colorado Center for Photomedicine. I wanted to talk to you a little bit today about sunscreens. There's a lot of misinformation on the web and being posted to people through mass media about sunscreens, so I wanted to give you a clear picture so you can pick the right thing off the shelf. First thing we're going to do is talk a little bit about light. The main two types of light that we need to talk about are UVA light and UVB. UVA is a little bit longer. That's the kind that's used in tanning beds. That type of light is actually what causes what we call indirect DNA damage. The problem with indirect DNA damage is that's what causes the more serious types of cancer like melanoma. So when you go to the tanning bed and they're telling you that UVA light is safe and that it produces more vitamin D, they're actually lying on both accounts. The other type of light that we hear about is UVB light. That's the kind that's protected by SPF. UVB light is actually what activates vitamin D in your skin. It also is what causes indirect DNA damage. That leads to more slow-growing types of skin cancer, such as basal cell carcinoma or squamous cell carcinoma. Now, when we talk about our sunscreens, I want you to look at the label. In most sunscreens, you'll see an SPF. That number only talks about UVB. Okay? And if you look at this one over here, you'll see an SPF of about 30. That tells you that you can spend almost 30 times more time in the sun than you would have been able to normally and still not get a burn. Okay, that's helpful, but it's not helpful enough. What you really need, if you look down a little bit further on the label when it says broad spectrum, is a type of medication or a type of sunscreen that does both UVA and UVB. Okay, if you're protecting against UVA, that's going to keep you protected against those indirect types of DNA damage. Now, the other thing that we want to talk about is the chemical sunscreens, and those are the more popular ones now, the Helioplex and a lot of these that have come out at least recently with a lot of fanfare and a lot of marketing. The problem with these is there's a few issues. The first one mainly being that those sunscreens actually take a while to be absorbed. So as you put them on, unlike these metals that sit on the skin, these sunscreens have to be absorbed over about 30 to 45 minutes before they start working. So you can't put them on right before you walk out the door. The other issue is there is actual absorption into your system. So there's some issues to what these particular chemicals convert to in the body. I don't think we have excellent literature on it now, but we're working toward really figuring out what these chemicals do once they're processed by the body. A lot of them look like female estrogen type of hormones, and the view is looking from the research that that's not a great deal. With the physical barriers such as titanium and zinc, which you'll see on a product like this, those physical barriers sit on the skin, they don't do anything else, and they wash off at the end of the day. They're not actually absorbed, and they do a wonderful job of preventing both UVA and UVB light absorption. So what you want to do when you go to the grocery store, when you go to Walgreens, is pick out a sunscreen that doesn't have a lot of filler in it. Look at the ingredient list. The two ingredients that you want to see are titanium dioxide and zinc oxide. Okay? Titanium dioxide will cover for the UVB, zinc oxide will cover for the UVA. Gives you a nice broadband protection. We've got a long history with these medications. We know they're safe, and they're not going to cause you any problems later on down the road. To make sure that you don't get a white pasty look, make sure that the zinc is micronized, and you'll get a lot more cosmetically elegant look from your sunscreen. And if you have any questions, give us a call. We'll be happy to answer them.